Good morning from Nairobi. My name is Sarah Kimani. Now, there are close to 50,000 confirmed cases of COVID-19 in Africa and about 1,800 deaths. The continent was late in getting these cases. However, we are now standing on a precipice according to the World Health Organization. Some people, however, said that this is an opportunity for the continent to develop its manufacturing sector, to develop its health systems, but even to become self-dependent. Now, to discuss these issues and more on how the continent is responding to COVID-19, I'm joined live by the African Union High Representative for Infrastructure Development, Mr. Raila Odinga, just to take us through all this. Thank you so much, sir, for joining us. Now, one of the issues that has come out over and over is that Africa could have done better in terms of preparedness. The disease almost wanders. We heard it in China and then to Europe and the rest of the world, and we were the late recipients of the disease. There was the African Union Summit in February. Could the leaders then have done better, spoken about closing our borders early, closing the airspace early?
Well, Sarah, I don't think that Africa was not prepared. Because how would you have been prepared if you didn't even know the magnitude of the pandemic which was coming? I don't think that the information was shared very well internationally. I attended the last AU summit in Addis Ababa in February, and nobody even talked about this because I don't think that even the WHO shared the extent of the danger that the entire global community was exposed to. So, but then what about the response? I think that the continent has responded pretty well, given the fact that Africa is now actually witnessed the lowest rate of infections compared to other parts of the world. And most African countries have been very proactive. For example, South Africa, the first one to call for a total lockdown, followed by Rwanda, Uganda, and Kenya, and Nigeria, and other countries. So I think we've been able to contain the extent of damage of this pandemic on this continent.
We saw the lockdowns immediately after that followed, but they were successive. Like you said, South Africa started in the East African region. We had Rwanda and Uganda act very fast. Would you say the coordination efforts by the continent have been enough? Could we do more?
Certainly, yes. I think we could have done more. I think that the AU should have been more proactive in passing information to member countries and basically compelling them to agree to take actions, preventive actions in this front. I think it's a lesson that we can, going forward, we need to work in a more concerted way. You see, the European Union is closer, more closely knit, and I think the information was shared much faster there. But as you can see, a number of those European countries have become serious victims because some of them were late in acting, despite the fact that they had the information. But here on the continent, we have managed to. There are other countries which have been slower, but by and large, I can say that the majority of African countries have responded pretty well to this pandemic.
When you look at the lockdowns and how they have affected our economies, you find in countries like Kenya, hotels closing down, small-scale businesses already complaining, bigger countries like South Africa also saying our economies are going to be hit. They're now talking about negative growth. In your opinion, how badly do you think we are going to be hit, and how do we come out of this?
Sarah, if you ask me, to me this is a third world war without the bombs. Because even during the Second World War, we did not have the extent of casualties that we are witnessing within a very short period of time. You take, for example, the United States. In the war, there was no theater when they lost 2,000 people men in a day.
Yes.
Apart from the Pearl Harbor. Now they're losing more than 2,000 every day. Look at Italy, look at France, look at Spain, look at Britain, and so on. So the continent of Africa has not been spared either. And the effects are going to be far-reaching as a continent, because the entire world has almost come to a standstill. The factories are not working. Many people have become jobless, and you could see that many people are dying all over the place. There's no international travel. Just imagine how many planes were in the skies when things were moving. Jomo Kenyatta has not seen a passenger aircraft land there for the last, this is now the third month running.
Yes, we are on the third month.
So nothing is coming into the country. Tourism has died. People are working only half the time, and just very few people are working. Productivity has gone zero. So most African economists, I would say virtually all, are going to be very adversely affected by this epidemic. And we really need to now look forward to the post-COVID era. What are we going to do as a continent to revive our economies? And I believe myself that this is a crisis, and as they say, each and every crisis also offered an opportunity.
Indeed, that was going to be my question, because last week you wrote a comment when you said this crisis offers an opportunity for Africa. And that's why I asked you, how do we recover and how do we now take this chance as a continent?
We must see that Africa is going to be left on its own. You see, Africa has depended so much on the international community. Most of our trade, you could say, is to the external world. Africa's internal trade, as before COVID, was only 15%. Meaning that 85% of our trade is with our external world. And most of it is commodities which we're exporting. We're exporting oil, we're exporting minerals to the external world, and in exchange we're bringing in manufactured products, textiles, foodstuffs, electronic goods, things like tractors, automobiles, and so on. Now, that kind of opportunity is now not going to exist, because most of those economies are also affected. So we need to now look internally, intra-African trade. And that actually was signed. The Continental Free Trade Agreement came into effect last year. So the COVID pandemic gives us opportunity to realize the African Free Trade Area Agreement, that we need to now open up the continent. So the opportunity now exists to do connectivity in terms of infrastructure development. We need to think of how we can connect so that goods can flow freely from one African country to the other, okay? And then we need to promote now the trade, import and exports. But more importantly, we need to now do value addition. Whereas in the past we were exporting raw materials, we now need to make manufactured products. So instead of us exporting, for example, iron ore, we should be now manufacturing steel and steel products. Instead of exporting copper ore, we will be able to now export copper cables, copper products. Instead of exporting bauxite, we'll be exporting aluminium finished products and so on. Even gold, we should be processing gold, not raw gold or as ore. For example, even diamonds. We should be having diamond cutting facilities on the continent so that we export diamond products, not just raw diamonds.
And indeed, we've seen
oil. An opportunity for petrochemical industries to come up on the continent. so that we now manufacture finished products in this continent. And this is a challenge that Africa needs to take. And I'm sure that African countries will wake up to this reality, that nobody is going to help them, because everybody has been affected. And you cannot expect help from Europe when Europe itself is on its knees. The United States is crying, even China is crying. So Africa must just rise up and become Africa, and I know that it is possible.
It's interesting you say that, because we've seen Senegal producing a $1 test kit. We have seen countries like Kenya, South Africa, Ethiopia saying we are now going to make our own ventilators. What does this disease offer in terms of our health systems? First, have we been exposed? Have our health systems been exposed this far? And what opportunities now lie for the health systems?
You see, our health system has been now exposed, and it has been found to be wanting, that it is not ready to respond to the challenges. But because of this, we are now beginning to think out of the box. What do we do? Cannot be able to get ventilators from Europe, the United States, or China. They themselves also need those. They don't have enough for themselves. So we must do it for ourselves. And you can see now the African brain mind is beginning to work. The students at the Jomo Kenyatta University have come up with a ventilator, which can now be produced commercially. See, they say that necessity is the mother of inventions. So the Africans are now becoming inventors rather than copiers of other people's technologies. This now gives us time to think out of the box. And you see, what happened when Hitler was challenged seriously during the Second World War? He set up a research institution that was called Panemundi. It was led by none other than Werner von Braun, the guy who started NASA. And that's where they started the idea of manufacturing the nuclear weapons. So, because Germany was challenged, Africa is now challenged. In my view, this is the time to realize Kwame Nkrumah's call for the continent, that Africa must unite. We have no other one, nothing to lose but our chains. So Nkrumah called for it many years ago. He was like a dreamer. But now has been proven to be right, that Africa will only develop as a unit if it is united. And we need to go and look at the regional blocks, strengthen these regional blocks, and come up with a real unit at the continental level, where we can have ministers in Africa in charge of health, in charge of agriculture, of food production, because that's another challenge here, in charge of infrastructure, in charge of trade, in charge of ICT, and so on and so forth. So that decisions are not just made in Addis Ababa and left there to rot until the following year's summit. That there is a mechanism to do follow-up, so that there's implementation of the good ideas which emerge every year at the AU Heads of State Summit in Addis Ababa, but never see the light of the day.
Indeed, the only thing we have to lose are the chains. However, we are backward with debt, we are backward with all these grants that we have, and now African leaders are also coming together to ask that debts are forgiven, so that they can be able to develop their health systems and that they can be able to respond to the disease. What is your response to this?
Certainly, the challenge is enormous, and the capital requirement is going to be also gigantic to be able to deal with the effects of this onto the economies of Africa. And you cannot actually be expected to be doing this and at the same time repaying this heavy debt which Africa is carrying. This is really the time for the Africa's partners to have a look at the Africa's indebtedness and begin serious discussions. This can be done at multilateral level, but also at a bilateral level. To talk first, look at what is possible in terms of debt write-offs. Secondly, what about rescheduling, debt rescheduling and restructuring? For example, looking at the rate of interest and so on, things like those. This happened in the Second World War. I just think of Europe post-Second World War. The whole of Europe was in rubbles, in shambles, and they had to start reconstruction, and they had to think out the box. That's how the idea of Marshall Plan to reconstruct Europe came up. You see, the United States, fortunately, was not as destroyed. So the United States was able to inject some capital. But then they had the manpower, which is another advantage that they had for reconstruction. But now they looked at what was really needed at that time. And they said, for example, just the reconstruction of their industries, of their infrastructure, of their buildings and so on was necessary. So they put a lot of emphasis on things like masonry, plumbing, carpentry, electrical works and so on and so forth. And they trained people quickly and they started to do the work. I was in Germany. I went to Germany literally 15 years after the reconstruction work had started. And when you went to West Germany and I went to Britain, you'd think that Britain lost the war and Germany won the war because of the amount of work that had gone into the reconstruction of what had been destroyed in the war. So our economies are now limping on their knees. But this now gives us also opportunity to have a rethink and a look at our development paradigm and see if we have not followed a wrong path. Instead of taking 55 years to reach where we are, probably we need a shorter period. Examples abound in the world. I've given you post-World War Europe. Another example you can think of is China, which after the reforms which they started, within a period of 30 years, they have been able to move over 500 million people from poverty to middle income status. This can be done. Korea, South Korea did it and moved. And this is just in a short period of time, 1970, when General Park Chung-hee came to power in South Korea. And he came up with a philosophy called the Somuldong philosophy and transformed the Korean society so that when you go to rural Korea, you would wonder when they tell you this is Korea before 1970 and this is Korea after 1970. So this can be done in our continent. And I really want to urge African leaders to look at this as an opportunity, think out of the box, and move on, and move Africa from poverty forever. This, in my view, would be the advice that I want to give to our heads of states.
Before we wind up, we want to talk about credibility. African governments are finding themselves having to beg people to come and take the test or to wear face masks or to even believe that COVID-19 is on the continent. How well can they communicate this message? How well can they get the message that indeed the disease is with us and we need to take precaution?
People just need to be told that this is real. COVID is real. COVID is not, you can call it a curse, or is not a dawa.
It's not a rich man's disease?
It's not a rich man's disease. COVID does not discriminate rich, poor, old, young, women, feminine or male. It is a disease for everybody. It is also a white man's disease. It is a black man's disease. It's a brown man's disease. So it is all it's a threat against humanity. And we need to take it seriously. You can say we are registering lower figures, but this may not be the real case. This is to do with the number of people we are testing. Maybe our sample sizes are much lower, hence we are recording fewer casualties. You see that, for example, here in Kenya we are testing about 1,000 per day. In the UK, just one day, this last week, they tested 79,000, call it 80,000. See, and then they found, say, about 1,000 people who are infected. As we are testing 1,000, and we are getting about 45 people affected, it means our rates are higher. So we need to increase the samples. We need to have more testing facilities available and spread around the country. Because we may be thinking that we are managing, and this thing is actually affecting many more of our population. So it is not really, in my view, the time to celebrate. It's time to be cautious. It's time to be careful, to think that there may be a danger looming somewhere. It's better to err in caution than to be complacent. So I would really urge our African people to believe that this disease is defeatable. Just like the other pandemics that have befell the human community over the past periods, past generations. This one here, in my view, is also going to be defeated. But after how many casualties? My view is that if we can save lives, let us save those lives. Let us live to tell the story. Let us not be part of those who will be counted as those who died during this pandemic. It is possible, and Africa will arise.
What a better way to end, Mr. Odinga. Indeed, Africa will rise, and Africa is proving that it can improve its capacity, whether it is in manufacturing, whether it's even dealing with the disease. We've seen countries like South Africa test up to 10,000 people in a day, while other countries are testing up to 1,000. And this is where Odinga is talking about issues of collaboration. How does the continent collaborate in improving health systems? How does the continent now start to look inward in terms of trading, so that once the continent comes out of this, it comes out stronger, and economies do not get as battered as we have seen in the rest of the world. Until next time, it's goodbye from Nairobi. Thank you, sir.
Thank you there to Sarah Kimani. You're watching The Agenda. Let's take a break.